Okay, so we're looking at the pathologic fractures. Pathologic fractures. So pathologic fractures is more of like you're having a fracture simply because the bone is weak due to an underlying disease condition. Do you understand? So if you checkmate it, if you pinpoint it, you get to see that there's a disease condition under that is causing the issues. So a pathological fracture is just a bone break, and it occurs in a bone, and the bone is weak because there's an underlying disease condition that is causing it to be weak. Okay, so it's not due to a normal trauma or mechanical stress. So in other words, the bone fails under forces that would normally have not caused a fracture, simply because there's an underlying disease condition that is like making those forces like to amplify. So different causes could be due to an underlying metabolic bone condition like osteoporosis, osteomalacia, rickets, hyperparathyroidism. It could be because there's a cancer there. So cancer, if cancer is growing in bone, or if cancer is spreading to bone, it weakens the bone cells. So primary bone tumors, metastatic tumors from other places to the bone, then also multiple myeloma. Okay, so that's what we got. Then what again? Then okay, infectious issues like osteomyelitis, tuberculosis of the bone, osteogenesis imperfecta. Okay, the clinical features is fractures occurs even with the minimal trauma. There's any issues just little about it, there'll still be fractures, and pain may precede the fracture due to an underlying pathology. There's deformities, there's swelling, there's loss of function at the site, and it often occurs in vertebrae, femur, the humerus, or the pelvis. So history, you have all those low energy fractures, and the person is known to have a bone disease or cancer history. So x-rays and MRI and CT scans, bone scans and laboratory tests, and also biopsies could actually be used to diagnose it. Okay, so treatment, the person will stay in a position that's will place in one place for a very long time. Then you address osteoporosis, address malignancy, address the infections, and the rest of it. Okay, so that's what we have for pathological fractures.